Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Materia Medica series. Today I'll be discussing phosphoric acid, or Phosphoricum acidum. This homeopathic preparation is made from phosphoric acid, which is a corrosive inorganic acid compound that comes in various chemical configurations. Don't be confused by the fact that some sources refer to the same remedy as acidum phosphoricum. Dr. Hahnemann used metaphosphoric acid to make his original preparation of this remedy. It's a clear, glassy solid represented by the chemical formula HP3O4. It's also referred to as glacial phosphoric acid. Phosphoric acid can be extracted from the bones of animals, and of particular importance to us is the fact that it's an ingredient commonly used in making carbonated drinks, especially cola drinks. I urge you to keep this in mind as we discuss the materia medica of phosphoric acid.
Okay, so according to one source, there are 37 homeopathic remedies made from acids. These include some of our well-known remedies, such as nitric acid, muriatic acid, picric acid, fluoric acid, sulfuric acid, benzoic acid, and oxalic acid. Of course, there are lots more. An acid is a substance that has the capacity to burn through various materials, and correspondingly, the homeopathic acid remedies are often indicated for those who suffer from some kind of burnout. The various causes and symptoms of burnout differ from one acid remedy to the next. Phosphoric acid happens to be one of our most commonly indicated burnout remedies. Now, the underlying theme of phosphoric acid is best characterized as a struggle with adversity that leads to emotional burnout. And this burnout manifests primarily as exhaustion and indifference. The person who needs phosphoric acid has had to endure a particularly difficult ordeal. I'll talk about the nature of this ordeal later on, but right now I want to describe the Phos-Ac burnout state itself. As a consequence of dealing with adverse circumstances, the person who needs phosphoric acid begins to collapse. He or she becomes emotionally worn out. There's no energy left to care about anything. This person has done his or her best to cope, but is now exhausted from the fight. There's nothing left to give. All that remains is a combination of fatigue and apathy. Let's talk about these two factors one at a time. Okay, so the first factor to consider is fatigue. Regardless of the specific nature of the adversity, it sucks the life out of the phosphoric acid type. He is tired and worn out, especially on the emotional level. Phos-Ac is primarily a remedy for emotional fatigue. Fatigue begins on the emotional level and can sometimes extend to the physical and or mental levels. He feels unable to cope with the emotional demands of events. He is too emotionally worn out to respond. As a result, he may feel nothing or may complain of feeling numb. He is weak, drained, and chronically fatigued. Any emotional strain or exertion only leads to further exhaustion. Although the books emphasize that Phos-Ac is a remedy for grief, it looks more like a state of collapse than actual grief. Some references describe phosphoric acid as being indolent, and it lists in repertories under indolence. Technically speaking, indolent implies a lazy aversion to work. And while phosphoric acid may appear to be lazy, the real issue is that he just doesn't have the energy to exert himself emotionally or physically or mentally. Sometimes he can be so tired that he's inclined to lie down. On the mental level, fatigue can manifest as forgetfulness. The mind becomes weak, especially after grief. He forgets words and suffers from brain fag. Another word that describes phosphoric acid is listless. He's so tired that he loses interest in wanting to do things. And this leads us to the next key feature of the phosphoric acid state. All right, so the primary manifestation of phosphoric acid's fatigue is apathy, or as the books put it, indifference. This is the first impression we get when such a patient presents in the office. It's not just that she's tired, she gives the impression that she's too tired to care. Her affect is flat and apathetic. She is expressionless, as if she lacks the energy to show emotion. It requires energy to experience emotion, to care, to worry, to stress over something. But the Phos-Ac patient has no energy for that. She appears to be washed out, burnt out, even lifeless. Some describe this Phos-Ac state as a form of depression, which it is, but it's not like the deep, dark depression of an Aurum type. Like Aurum, Phos-Ac may admit to feeling despair or hopelessness, but she shows no inclination to do anything about it. It's more comparable to the indifference of a sepia type, with the main difference being that sepia's indifference has a hormonal etiology. Phosphoric acid's indifference comes from being drained of energy. There's an absence of feeling, an absence of emotion. She feels nothing and may even complain of feeling dead inside. She loses interest in the things that previously excited her. The phosphoric acid type may say things like, "What's the point?" or "Who cares?" or "There's no use in trying." She wants nothing, cares for nothing, and asks for nothing. She doesn't have much to say and would rather be left alone to brood silently. Phosphoric acid is the main remedy for those who have become chronic couch potatoes. They sit around all day watching TV and doing nothing. They don't have the energy to do anything else. When a friend calls to ask if they'd like to go out to dinner or a movie, they make up an excuse and say, maybe next time. The number of indifference rubrics that include phosphoric acid gives us a sense of just how important this keynote feature is. We find it listed under mind indifference, indifference on waking in the morning, indifference with emaciation and weakness, indifference during fever, indifference with weakness, indifference with weariness, indifference about business, complete indifference. Indifference has no desires, no action of the will. Indifferent and taciturn, meaning not talkative. Indifference to everything. And lastly, indifference to life itself. Phosphoric acid is found in additional indifference rubrics, but I think I've made my point here. Now, of course, most people who need this remedy aren't going to just hand it to you on a silver platter. They're not going to blurt out, "I'm burnt out and apathetic and I don't care about anything anymore." In fact, they can be quite reluctant to speak. In such cases, we must observe the state of the patient, know the right questions to ask, and be able to read between the lines. So the way in which the Phos-Ac type speaks is another telltale feature that can point to this remedy. In accordance with his flat, lifeless affect, the Phos-Ac type, not surprisingly, tends to give short answers. He's not particularly communicative. He thinks long and is slow to answer. He's not inclined to answer questions and may respond irritably. Sometimes he's so overwhelmed that he's unable to respond at all. Rubrics that illustrate this taciturn tendency include aversion to answering, answers monosyllabically, answers reluctantly, answers slowly, thinks long before answering, and anger when obliged to answer. In addition, Fossack lists prominently under the following rubrics: desires nothing, deficiency of ideas in brain fag, prostration of mind after grief, prostration of mind mental exertion aggravates, prostration of mind with bodily weakness, taciturn from weakness and debility, aversion to thinking, brooding after disappointment, brooding after disappointed love, and dwells on past disagreeable events. So in summary, adverse circumstances wear the Fossack type down until he begins to burn out and collapse. He's emotionally fatigued to the point where he has no energy left to respond. Instead, he sinks into an apathetic state and sits around like a couch potato, disinclined to do or say anything. He may also experience physical fatigue and sometimes mental fatigue. All right, now let's talk about the types of situations that can bring about this Fossack state of fatigue and indifference. Now, by the time I'm done with this list of etiologic factors, you'll probably say to yourself, gee, it seems like just about anything can lead to a phosphoric acid state. And that's pretty much true. So the specific circumstance is less important than the overall toll that it takes on the person. Regardless of the type of event, it's either the intensity or the prolonged nature of an adverse situation or the profound degree to which it affects the person that counts the most. So with this in mind, here are some etiologic factors that are likely to produce a phosphoric acid state. Grief, loss, and disappointed love are common triggers. Think of the teenager in love who took a breakup with a girlfriend or boyfriend very hard. Think of a person who's experienced the deaths of several loved ones over a relatively short period of time. Another common trigger is illness. It's not unusual for a severe bout with an acute illness or a prolonged battle with a chronic illness to suck the life energy out of a person. So we think of phosphoric acid in cases of chronic fatigue that are never well since an illness. Similarly, we think of it in cases that are slow to recover after a surgical procedure. Various sources list additional etiologic factors, including bad news, overstudy, embarrassment, deceived friendship, drug abuse, and alcoholism. These events, in and of themselves, wouldn't normally create problems for some people. So again, it's not the specific event itself that generates the trouble, as much as the intensity or prolonged nature of the situation that can wear down the energy of the person. All right, now let's talk about some generals and modalities. Okay, so generally speaking, phosphoric acid tends to manifest its pathology more so on the mental emotional level, in the nervous system, the musculoskeletal system, and the gastrointestinal tract. It sometimes fits those with tall, thin body types, and as we'll see, especially adolescents who have just undergone growth spurts. But it can also fit people of any body type. In terms of food and drink, there tends to be a distinct preference for refreshing things. This includes fruits and fruity, juicy, cold things, like a cold, refreshing, juicy drink. Phosphoric acid also likes cold milk. But the big keynote clue is a desire for carbonated drinks. Recall that phosphoric acid is an ingredient added to some carbonated drinks. If I suspect that a patient needs phosphoric acid, I make a point of asking whether he or she likes carbonated drinks. If they say yes, I inquire about how much they drink and how often. I've had more than a few people admit that they drink a six-pack or more of cola per day. Then I'll ask why they drink so much. And it's one thing if they say that they have a sweet tooth, but when they say that they like the bubbles or the carbonation, it's a strong indication for phosphoric acid. It's as if refreshing things, and especially the bubbles produced by carbonation, help to temporarily rouse them from their fatigued and apathetic fog. One exception is that sour fruits or drinks can aggravate in some cases. Another general is that Phos-Ac tends to be a little on the chilly side and can be aggravated by cold air, cold drafts, or cold, damp weather. Another important keynote clue is a feeling of being unrefreshed in the morning, even after a good night's sleep. Phosphoric acid has a very difficult time waking and getting going in the morning. They're very much inclined to remain in bed and sleep late. Some repertories list it and others don't, but I can confirm that Phos-Ac is both unrefreshed on waking and indisposed to rising. Okay, so in terms of modalities, phosphoric acid symptoms can be worse from cold or a cold draft and better from warmth. And Phos-Ac is one of the main remedies indicated for problems that are aggravated by excessive flow of bodily fluids. This can refer to blood loss, excessive perspiration, urine, or diarrhea. The homeopathic literature often refers to this as loss of vital fluids. Although phosphoric acid is known for a tendency toward diarrhea, and this can lead to collapse and exhaustion, sometimes it does not. So conversely, when the patient does not become weakened from chronic diarrhea as one would expect, we also think of phosphoric acid. Another important modality is that phosphoric acid symptoms are typically ameliorated by sleep. Even a short nap can temporarily refresh and relieve. Sometimes we see an aggravation from noise or even music. Another interesting modality is that Phos-Ac pains tend to be worse on the side lain on, or can go to the side lain on. Phos-Ac symptoms can also be aggravated after sex or after sexual excesses or excessive masturbation. And the older literature often refers to this as another example of loss of vital fluids. And just to be complete, all of the previously mentioned etiologic factors, like grief, chronic illness, and other forms of adversity, can also serve as aggravating factors. To be clear, an etiologic factor is something that triggers an illness at its very beginning, whereas an aggravating factor exacerbates an already existing condition. All right, now let's discuss some of phosphoric acid's physical symptom tendencies. Okay, so it makes sense that phosphoric acid is indicated for chronic fatigue in its many manifestations. It fits chronic fatigue as a sequela to mononucleosis, chronic fatigue in combination with diabetes, chronic fatigue from colitis, and chronic fatigue with hair loss. In fact, it's the main remedy for hair loss caused by grief. There may be hair loss from the head, the eyebrows, or the beard. Sometimes there's premature graying of the hair. Phos-Ac is also one of the main remedies for diarrhea caused by grief. The diarrhea tends to be painless, may be involuntary, and as noted earlier, can occur without causing weakness or prostration. Another Fossack keynote clue is bone pain, especially bone pains that are worse at night. Bone pain at night is a characteristic of the syphilitic miasm and the syphilitic remedies. Fossack bone pains are often described as gnawing pains. There may be a sensation as if the bones are being scraped. It's also a remedy for bone inflammation or bone infections, also known as osteomyelitis. Some additional clues that point to Fossack include night sweats, dryness of the mucous membranes of the eyes, nose, mouth, or tongue, and milky urine or urine-like curdled milk with white curds produced at the end of urination. Lastly, Fossack can be indicated for children and especially for rapidly growing adolescents. It's one of the main remedies for homesickness in kids, and commonly it fits tall, thin kids who experience sudden growth spurts. The rapid change in metabolism can sometimes sap all the energy from the young growing teenager. Fossack is also one of the main remedies for growing pains of adolescents. Think of the common stereotype of the teenager in the middle of a growth spurt. Practically overnight, he grows taller, becomes fatigued, and sinks into a chronic state of apathy with a distinct tendency to sleep late, sometimes rising from bed as late as noontime. He loses all interest in things, mopes around the house, and speaks only when spoken to, often responding with a yes, no, or I don't know. Well, guess what? It's not really a stereotype. It's a common scenario that practically screams for treatment with phosphoric acid. Sometimes we also see headaches, bone pains, especially leg pains, or heart palpitations associated with adolescent growth spurts. I once saw a young adolescent boy suffering from tremendous fatigue. He sat slumped in his chair, saying nothing. His long, skinny legs had begun to give him trouble. He was losing coordination and was having a hard time walking. He'd seen his pediatrician and various specialists, including a neurologist, but no one could quite figure out what was wrong with him. The interview revealed that he had undergone a pretty dramatic growth spurt around the same time that his symptoms began. Repeated doses of phosphoric acid over the course of a few months pulled him right out of it. When I last saw him, he was sitting straight up in his chair, he spoke to me, and he walked without any difficulty. Okay, let's finish up with remedy relationships. Okay, so China is the one remedy consistently listed in the books as being complementary to phosphoric acid. And the main connection is that both remedies are indicated for ailments caused by loss of vital fluids. Remedies worth comparing to phosphoric acid include sepia, which is similarly apathetic and indifferent, but usually for hormonal reasons. And compared to phosphoric acid, there is less emphasis on fatigue. Silica is also tall and thin and fatigued, but is not typically apathetic. Calc phos is tall and thin, unrefreshed in the morning, and fits kids with growing pains. Phosphorus likewise fits growing pains and desires cold, refreshing things. Halebris also takes a long time to reflect before answering, but its apathy and depression are usually caused by an insult to the brain or nervous system. Carcinosin is commonly indicated in cases of chronic fatigue. It also fits cases that have never been well since some illness, like flu or mononucleosis. Picric acid is primarily a remedy for mental fatigue and collapse, especially when the exhaustion is brought on by mental exertion or overstudy. Muriatic acid is another remedy for weakness and collapse, especially on the physical level. And finally, gelsemium is commonly indicated for weakness and fatigue, especially in cases brought on by fright. All right, that's my take on phosphoric acid. I hope you enjoyed it. Thanks as always for watching. It definitely helps this channel to reach more people if you take just a moment to like, comment, and subscribe. Please tune in again to the next All Things Homeopathy episode, and may the vital force be with you.
May the vital force be with you.